Hello and welcome. I am Deborah Pascali Bonaro of Orgasmic Birth, and you're here with us in our Orgasmic Birth Practitioner membership, where we talk everything about healing, expanding, learning, and bringing together more joy, love, and pleasure to birth, how we can positively prepare for birth and parenting. And today I'm really excited because I have a very special guest, not only a dear friend, but an amazing wise woman. Tammy Ryan has been attending births since 2002. She's been a birth doula trainer for DONA International, which is how we met years ago. She's a childbirth educator and midwifery assistant, and one of the 15 trainers worldwide for spinning babies. Tammy sat on the DONA International Board of Directors, plus several other boards. She started working internationally in 2008 when she went to the DR Congo to train life-saving skills in childbirth, according to the World Health Organization. She has served in Haiti, Rwanda, Burundi, Tanzania, Kenya, Korea, Japan. We were there together, India, Israel, and Brazil. Tammy has presented childbirth information to several venues, including international conferences, TV, radio, universities, and ministries of health. And she's published in Quarterly, International Doula, and several blogs. Tammy teaches when survivors give birth, which is what we're covering, this important topic today, as a way to help survivors and birth workers. She's experienced firsthand the barriers that women face worldwide in getting adequate care in childbirth and postpartum. So welcome, Tammy. I am just so honored you're here today, and especially to guide us is such an important and sensitive topic.
Hi, Deborah. Thank you for having me. I'm thrilled to be here today and to really kind of just give you an introduction to this topic. And really, this is actually a full workshop when survivors give birth, but I wanted to be able to share with you and everyone listening just kind of the intro of what we cover in a class and what this would look like, and just kind of hit some key points on how we can identify and really how do we use our words when we're working with people. And so just going to kind of jump right in. And so when we start to think about working with survivors, and just kind of starting to identify people, we probably have all worked with somebody that has either not been able to tolerate those vaginal exams or blood draws, extreme modesty. We've been at those births where it's just very uncomfortable anytime that they are changing clothes, or what are they wearing is another big one. We can see anger or distrust with medical authority figures. Sometimes we see those really long, lengthy birth plans where almost like they're trying to lay out every single detail and not leaving room for variations. We can see unexplained failure to progress, profound disappointment with their birth or their caregiver, even their partner and doula, and maybe lack of interest in even seeing or holding the baby. And when we come across these things, many times there's something they have in common. And, this is what today is talking about, is it adverse childhood events or child abuse. And, we're going to be talking more about the sexual abuse, but recognizing that there are other childhood abuses that are out there that can affect the birth experience. It can be a physical abuse or emotional abuse, such as neglect, loss of a loved one, especially of a parent when you're very young, any witness to a violence or tragedy, any kind of domestic violence, physical abuse. And then, of course, today, we're going to be talking about sexual abuse in there. And so the true definition of childhood sexual abuse takes place between a child under the age of 18 and an adult or someone close in age who the child perceives as more powerful. And so we do know, this is going to be any adult figure in that child's life. It consists of any activity the abuser expects to cause sexual arousal in the abuser or in someone else that may be there. Generally, the person is, it can be a parent, a step parent, sibling, other relatives, also respected elders, neighbors, schoolmates, teachers, coaches, religious figures, scout and youth leaders, strangers. I mean, the list really goes on who this could be. Really the tip of the iceberg when we talk about this, because we know that so many cases are not reported. And so there's a very good chance that even though you may say, I don't think I've ever worked with somebody that has been abused through childbirth, most likely we all have. And I'm hoping today to just kind of give you a few tidbits as far as how do we recognize, and then what are the appropriate words we could use? What are some triggers we need to talk about? And how do our actions affect the healing? Because that's what we're looking at. What is the healing that can come so they can have births that are satisfying to them? That is what they hope for. And so sometimes I love this it's a direct question. As you said, it's finding those words that that we're all comfortable with. And this comes from a Norwegian midwife, but many women have had unpleasant sexual experiences, being touched or forced into sex, or they've been physically abused. Have you ever experienced anything like that? And I think it's such a beautiful way to open the subject up when we're asking. When we're trying to understand where a person is coming from. And then I'm really wording. The words that we use are so important because one word can really be a trigger to a person. And so we want to be cautious. If you're telling a person, and these are words that we all have used, and not intentionally to hurt anyone, but to understand that sometimes when we're telling a person just to relax, let go, surrender, we do have to remember sometimes those are the words that the abuser used. Just relax, this won't take long. And so just being very aware of our words. And really it's the next one. If you relax, it won't hurt so much. Trust your body. Do you want to do what your body tells you to do? And sometimes with that one, when we look at that is, in a survivor, many times their body told them to run away. We go into that fight and flight. And so we need to be careful how we use that. Tune into your body, or good girl. And so just remembering that these are words that many times a survivor has heard before in a different setting. And so they can be triggers. And so I know there's a lot on here. Just kind of wanted to look at it very quickly though with you. Just some important points for caregivers is that, again, this is anybody's role, the doula, the educator, the provider, staff, but hopefully to help create that safe environment. Really hopefully you have the time to make that rapport. And this will be different depending on your scope of practice, and listening to the concerns and feelings. Recognize that there's concern with touch, that these can be, triggers. And when we look at especially touch, and I think in a moment we'll be talking about consent, but not only the verbal consent, but what's the body consent? Just as simple as having my hand on their shoulder. Are they tensing when you're getting that consent? So always asking permission, and that we're going to work together in this. We want to try as caregivers to make sure we're reducing the stress in the entire room, especially at a birth, in the entire room. And there's many ways, again, that you can do that. Developing those safe place imaging that we talked about a few moments ago. And an imaginary container for your emotions. I've so much, this work, and I've had the privilege of studying under dear friends to both of us, Penny Simpkin and Phyllis Klaus. And I love the idea and the way they describe the container, this imaginary container that we can put, some of these triggers into. Self-help to reduce panic and staying grounded. Issues with privacy and body boundaries, their ability to birth. And just, again, this is just a lot of things as far as just points we all need to remember. continued skills to help reduce the tension, fear of a procedure. And so when we look at especially interventions that may happen in a labor, helping them go through all of them and the decision making. And to make, we all know to make those good decisions, they need to have the information in that. Once again, the importance of our words, and not only the words, but the tone of our voice. That tells a lot in our tone. And then going on a few more is watching our language. What does that look like? Even using phrases and reminders that the baby takes the pain away. The baby is the ally in the healing process here. Because sometimes for a survivor, they may really turn against the baby. And so we have to remember that. And there's going to be time for adjustment there. Control issues, so recognizing out of control behaviors. Again, we're creating those partnerships, keeping them informed, involve them in all decisions. Control over their own reactions. So normalizing the experience, acknowledging their way of coping, and recognizing that we all have a very different way of coping in different things, and help them to separate the past from the present. And so sometimes it's just as simple as bringing them back to right now, what's happening right now in that. So checking in with dissociative behaviors, ability to stay focused. And again, where are you right now? And I think, as doulas, we're always checking in. And again, this isn't just for the survivor. This is for every person that we work with, checking in where are they right now? Working with any kind of negative reaction, that we're going to validate those feelings, listen to them, and reflect back to understanding the experience and the meaning. And so I always want to reflect back with them, making sure that I understand and not changing the words they told me. Working with the contractions and, again, with permission, that we can work with every contraction with them, and acknowledging the pain, not just saying and telling people that, well, this is just the normal part, acknowledging it. We have to, nobody's feelings are wrong. We have to acknowledge what those are and help them express those feelings. Make sure we communicate with the baby, that the contractions are like a very gentle hug, that they're hugging their baby, the baby's being massaged, having what I love about all this is giving you so many different tools and what's going to work with the one person you're working with. And just being able, so, some people it's going to be those hugs or imagining that the baby's being massaged by the contraction, or easing into a better position, rotating through the pelvis. Making sure too that we work with the partners that are there. Very important part, modeling. As the caregiver here, the doula, we're modeling how things should be working in this room. A guide with appropriate touch and visualizations. And once again, always checking in with the partner on their feelings. And then general reminders is that each person's unique, help them to choose their own path, remain present and patient, just to help them feel empowered in all this. I love the caregiver's motto that this person has a very good reason for feeling this way, behaving this way, saying these things, believing these things. And I may be the target, but I'm not the reason. And I think if each person out there can really keep this in mind, that when working with a survivor or even a suspected that you may suspect there may not have been disclosure, that there can be anger, there can be hurt. And just because you're the person that they're telling, you're not the reason why in that. And so as we kind of wrap this part of it up, I just really wanted to have people understand that abuse is not over when it ends in this. And each of us can be part of the solution. And that's so important, that kindness that we can show. When I look at everything with orgasmic birth and the sensual side of birth, I've worked with many people that have been survivors and that have moved through the healing and with kindness and respect, working on strategies, have gone on to have those pleasurable births, everything they imagine. So I wanted everybody to know, like, we can be part of the solution, and it may be a smaller part of it, but we definitely can go on for those pleasurable births.
Oh, thank you so much, Tammy. I'm sure everyone here with us, or if you're listening later, we are filled with many emotions, right? You brought so much together for us in looking at the impact of childhood sexual abuse or sexual abuse on birth. And you really helped us move through like the triggers to what we can do, right? And where the system fails, and how we, especially most of us here, are doulas and other birth keepers, on how our impact can make such a difference. So, I'm just like, don't know where to begin. And I'd love for those that are here, if we can come out and screen share. I don't know if you can put up, if you have it in there, your website, or before we go on, maybe you can share, how can people be in touch with you to take your full class, to learn more?
I will be teaching a full class down in Florida, in Orlando, in January, at the end of January. And at the moment, the easiest would be just to email me in this. And my email address that can be used, do you want me to just put it in the chat? Maybe that's easy.
Please do, but say it out loud for those listening too.
Yeah. My email address would be servanthands123@aol.com. That would be just the easiest way for that. Or if you're looking for a class in your area, I'm all over the country, that we can definitely work with that too, and see what for next year for any birth worker.
Ring the bell and subscribe for more orgasmic birth expert content. And if you're a birth practitioner, visit orgasmicbirth.com to learn about our special resources just for you, and follow us on Instagram at Orgasmic Birth.